I'm Dr. Michael A. Pikos, and I'm here to invite you to the 2025 Full Arch Pikos Symposium to be held at the Ritz-Carlton Hotel in Orlando, Florida on October 2, 3, and 4. We have a tremendous lineup of speakers for those 3 days, as well as a full day of workshops on October 1st, that Wednesday. In fact, we have 5 of them that you can take advantage of. And I personally will be presenting on the most important complications that we face with zygomatic implants, specifically their recognition, their prevention, and of course, the treatment. Now, let me get more specific. Implant placement in general has been something that we've all been part of for many years. Now, specifically full arch immediate reconstruction and with the atrophic maxilla is a niche in and of itself. And with that said, there's a definite place for zygomatic implant therapy. Like any surgical procedure, complications will happen. So what I want to share with you during this very important presentation at the Full Arch Symposium is the following, and that is there are specific complications that are inherent to zygomatic implant placement, yes. However, as we know, there are specific indications for zygomatic implant placement that we cannot pretend don't exist. And what I mean by that is, yes, we have other remote anchorage solutions to full arch therapy for the atrophic maxilla. However, there are clear indications in terms of rescue cases where we have implant failures that we inherit, whether they're our own or from other clinicians. And specifically with the maxilla, once we are dealing with failed implants, now we get into areas of not a lot of bone left. So therefore, zygomatic implants play a role there, definitely. And in even our conventional full arch cases with the severely atrophic maxilla, we definitely have indications where we may not be able to engage a pterygoid complex with that implant. So if that's the case, well then those specific situations really mandate the use of a zygomatic implant. So once again, my presentation will focus on specific, most common complications we see from zygomatic implant therapy. And once again, looking at prevention, recognition, and treatment.